It was in January this year when the Smart Start program have invited organizations and groups to bid for funding to deliver Smart Start priorities as listed here. And very much those were the first priorities that started to emerge following the needs assessment work that has taken place, and also the first interim reports from the foundation work carried out by Robin, Sophie and Olwyn. So I will not be going through the slide. You can see for yourself. It's very much a repetition of all the themes, and including integration and also availability on top of that of quality childcare. There's been a huge demand for actually places or in good or outstanding settings. So we were looking for projects that would deliver one or more of those priorities, and the bidders had to demonstrate that their projects or the funding would be spent on things that have not yet been perhaps tried in Warwickshire, that would really help our families and children of 0 to 5s who need support most, or things that we can prove worked elsewhere and made a real difference. Projects that, well, the outcomes of which could live on and leave a legacy and build community capacity after they are completed, because we know that the funding is limited and the project's time is also limited. And also build the strength within the workforce as well. So not just provide the support to parents, to groups, to communities, but also to practitioners, particularly those working directly with 0 to 5s and their parents and carers. And obviously all of those projects had to demonstrate good value for money. So the funding that would be or has been awarded would deliver quite a lot. And 11 projects have been shortlisted and have been awarded the funding by the Smart Start programme. They all are working to provide more support and training to staff working with children aged 0 to 5 years and their families and carers. They're working to provide learning and speech and language activities, training and support to parents and carers, particularly peer support, and also the lower level emotional support that we know there is a gap and need for, but also programs which are more targeted programs and some therapies as well, particularly to those parents who are experiencing some form of emotional or mental health issues. Promoting and helping families to adopt healthy lifestyles. The projects are also providing specialist support to practitioners working with children who have special educational needs or disabilities, and also trying to provide support to practitioners, to those children themselves within the childcare settings that they are in. And also supporting families to reduce number of children aged 0 to 5 that are in care, and generally develop better online and other resources and information for parents, carers and practitioners. And there will be future funding opportunities. Some of you will be very pleased to hear. And there is a plan to open a small grant scheme, particularly aimed at smaller organizations, groups, to apply for, and that will be opening in September 2016. We're currently planning the project. In terms of the current projects, I know that some of those projects, many of them in fact, are still recruiting families and mums and carers of 0 to 5 to provide them with support they may really benefit from. So I would encourage everybody to have a look and speak to them. Thank you very much.